Limitations in the healthcare system related to Medicare and private insurance may create barriers in the provision of optimum clinical care and legal reimbursement. Medicare coverage is usually provided to individuals who are 65 years old or older. Younger patients may qualify for coverage because of a variety of reasons related to income, prior disability, or a diagnosis that makes them eligible to apply for Social Security disability insurance. Moderate to severe aphasia could qualify the patient for disability, but the patient's coverage would not begin until 24 months following approval. This would create a significant gap in patient care, which would need to be covered by private insurance. A 55-year-old who already has Medicare coverage would either have already qualified for disability with a different diagnosis, qualified for Medicare under low income, which would also get them Medicaid, or disability has already been applied for, and this scenario is occurring 24 months post stroke, which may indicate a more prolonged recovery path. In accordance with the Social Security Act, provision of Medicare payments may only be granted when there is reasonable and necessary care, which is often referred to as medical necessity. The other key requirement is that services provided must be skilled. Skilled services can best be described by considering Principle 1, Rule F of the ASHA Code of Ethics. Skilled services are services that only the SLP, with their education, judgment, and experience, would be able to provide. Something an SLP should know in this case is that skilled care does not mean that the patient must show measurable improvements in order to maintain coverage under Medicare. Services can be provided to prevent and preserve further decline in a patient. The SLP can address Medicare requirements and ethical tensions in two ways. First, through detailed and timely documentation, which is an ethical requirement under the ASHA Code of Ethics, Principle 1, Rule Q. Second, to address the family's concerns, the SLP can provide informed counseling regarding the plan for the patient's care and their situation so that they can be a part of the decision-making process.